Welcome to Demystifying Dermal Fillers. I'm Dr. Rosalind George, but I really started this because there's just so much misinformation out there and a lot of really fear mongering on products that are really safe and effective and can add a lot of value to people's anti-aging. So I wanted to kind of go through what they are, what the issues are, and what really is a safe way to do these treatments. So tonight's agenda, we're going to go through introductions, talk about what the current reality of cosmetics or aesthetics is, go through what exactly are dermal fillers, because I think there's a lot of questions about what they are, how we use them, how safe they are, and kind of debunking some of the myths, what to expect with a treatment, including not a live demonstration, but a demonstration that we had recorded in the office, and then just key takeaways. And also at the very end, we have thank you promotions. So please stick around to see what our upcoming promotions for the busy holiday season is, like I like to call it, the most wonderful time of year at WDC. So I'm Dr. Rosalind George, if anybody doesn't know me. I'm a board certified dermatologist, and I founded Wilmington Dermatology Center over 17 years ago. So what exactly is a board certified dermatologist? So I did 4 years of undergrad. I went to Virginia Tech, go Hokies, and then I did 4 years of medical school. And then you do 4 years of residency, specifically in dermatology. After that, I also did some preceptorships where I learned some laser as well as some cosmetic treatments, and then founded WDC right out of residency 17 years ago. Here we specialize in medical dermatology and cosmetic dermatology, which is actually kind of an important distinction. I can't tell you the countless times somebody's come in for a spot that they thought was just a cosmetic spot and actually turned out to be a skin cancer. I'm also a national trainer for injectables, and I've served on advisory boards for numerous product launches, and have great working relationships with all of these aesthetic companies. And I also currently serve as one of 8 national injectable complication experts for one of the largest cosmetic companies. So that means when something goes awry, somebody has a problem, they call me to help. I've also really have a passion for clinical research and have conducted over 90 clinical trials in the areas of dermatology, including many new neuromodulators or toxins and dermal fillers, as well as new indications for those same products. And not just about me, my team is amazing. This does not work without my amazing team. And we have over 40 experienced people in the office, including our physician's assistants, our nurses, our estheticians, our research, and our support staff. And we've been voted best in Wilmington 10 years in a row. So what's the current reality of cosmetics and aesthetics? How did we get here? It's rapidly growing. This field is rapidly growing. It's changed so much in the 20 years that I've been doing this. It's really kind of shocking sometimes. And there are numerous options that exist for these fillers and toxins versus just 10 years ago. And pretty much depending on where you are, there's varied levels of training of these individuals that are offering these service. So you have this explosion of new injectors, new products, and individual habits that have led to just overusage and improper placement of these products. And that leads to this reputation of unnatural looks. I am a trainer for some of the companies. I know how they train. They're training kind of a paint by numbers method and teaching new injectors, hey, you put a little bit here to start, and then you add there, and then you add there, and you have to use this number of syringes to get a desired effect. And really what happens is that people were getting overfilled, and we weren't really keeping people's individuality, and that's when you started to see people start to look weird. Now we have social media, such a big thing since 2008, and influencers and injectors are often sharing information that is incorrect or misunderstood. We are so lucky that we have the internet and we can get all of this information, but you really have to make sure that you're getting good information. And a lot of the algorithms are tailored to get you to share, and what shares is people who are hateful and people who are scaring people. And so that's where you see this proliferation of fillers are bad, fillers are dangerous. One of the good things about the aesthetic space right now is that there's always new innovations. So lasers, radio frequency devices, microcoring devices, different chemical peels, different products. It's allowing for better methods for us to treat patients with less pain, less downtime, and really give comprehensive results to somebody's anti-aging plan. Also really exciting, there are newer generations of longer lasting and faster acting neuromodulators. Those are things like Botox and Dysport, as well as new formulation of fillers. So what are dermal fillers and how are they used? So dermal fillers mostly are hyaluronic acid gels, which is a naturally occurring substance in our body, and that keeps our skin soft, hydrated, and plumped. And the dermal fillers are hyaluronic acid gels that can be injected into the skin. So we can use that to support lost volume. Think somebody's getting a flattening of their cheek or their lips are getting a little bit smaller. Also to smooth wrinkles and cheek lines, for instance, or to enhance features. I have a little bit of an underdeveloped chin. I had filler in my chin and it made a big difference in my jawline. Adding some filler to people's jawlines or lips. So we can either support structure or even enhance features with dermal fillers. And dermal fillers are very different from neuromodulators like Botox or Dysport. I can't tell y'all the countless number of people that come in and say, oh, I want some Botox in my lips. And yes, you can do Botox in your lips, but that Botox and Dysport, things like those treatments are meant to be put in muscles that move. And how they work is they are injected into muscles that move. They tell the nerve not to release neurotransmitters so that the muscles don't contract as strongly. So it's relaxing a muscle. It really won't work very well on static lines or volume loss. And then we have this whole other class of fillers, biostimulatory fillers. And these are very popular products in our office. What these are doing is they're injected into the skin and they help to stimulate the body's own collagen. These are names like Sculptra and Radiesse. Radiesse is a little bit of a dual filler and biostimulatory depending on how we use it. And Sculptra is the classic biostimulatory. And what that does is we inject it under the skin, it acts as a scaffold, and it reproduces the body's own collagen. Whereas the hyaluronic acid gels, and you can see on the left, those are things like the Juvederm line from Allergan or the Restylane line from Galderma, and also the Revance line, the Redensity, and the RHA2. Those are all very popular products in our office, and those are the actual hyaluronic acid gels that we're using to fill lines and create structure. A whole nother class of dermal fillers that are out there are these skin boosters. And what those are done is they're injected more superficially into the skin, and that provides a hydration and glow to the skin. I honestly was a little bit skeptical when we first were learning about these. I wasn't sure how they were going to be added to the practice, but honestly, they're really good for all patients, and the results have been great to give that glow that we lose as we age, unfortunately. So where do we typically use dermal fillers? There's a ton of FDA indications for the use of dermal fillers. The temples, and nobody ever comes in and asks for their temples, but it's one of the most impactful areas that we can treat. Under the eyes, very, very technically difficult. I would say probably 10% of patients that come into my office asking for under eyes are actually great candidates for under eye filler. That is something that you really want somebody with a lot of experience doing. I was an investigator on the Restylane Eye Light study, which is an FDA-approved filler for under the eyes, and we did it very, very slowly with lots of follow-up to make sure that we were giving the best results we could. Cheek rejuvenation, chin, jawline, nasolabial folds. Those are the ones by your mouth, your smile lines, marionette lines. Those are the ones that make you look like you're frowning. Those are the things that people always say, oh, are you sad? Those are a very popular area to fill in our practice. Lips, the little lines that are around the lips. You can even use some of the skin boosters as well as the biostimulatory fillers in neck and hands and even for chest wrinkles. Fillers are gradually degraded over time and they can last for a very long duration. So when they're doing clinical trials, basically they're looking at how long the patient is seeing results for a certain period of time. They're not following how long these fillers actually last in the tissue. And we're not required to do that to get an FDA approval. We have to show that it's a safety and efficacy. And what I've learned doing this over the years is that by doing repetitive treatments, you do increase the duration. So people really should need less and less filler over time. I've said this to patients who've come in for a consult. When you come in for the first time, your tank is empty, and we're going to have to fill that tank up. But we're not going to have to fill the tank up every single time that you come in. And really, patients that have been seeing me for 10 plus years, it might be rare that I need to do a lot of dermal fillers on them. We're mostly focusing on keeping up with neuromodulators and doing skincare and keeping their skin looking healthy. So duration is really one of those things where it really depends on the product. It depends on where the product is placed, and it depends on the person. because we are going to continue to age. So somebody might need lips one time, and then the next time I think, hey, you know what? We need to put a smidge in your temple. It really isn't a one size fits all. That's why experience is so important when doing this. The other thing I like to point out is there's lots of different injection techniques. So typically we think of needles, but also using a cannula. And cannulas actually in most places are a safer injection. So you'll see we use those a lot. There are certain places I still really prefer a needle because I need that finesse. Places like lips where I don't want to put a lot of product. Most people don't need a full syringe in their lips. So I like using a needle in the lips. And I also prefer the needle under the eyes in most cases as well. Actually, in the clinical trial for the approval of Restylane Islay under the eyes, the patients who were randomized to receive the needle had less side effects than the patients that were a cannula was used. So there's a lot of nuances to this. Everybody makes it seem like it's so simple that you can go to a weekend course and learn how to do this, and that's just not the case. So here are a couple before and after. So this is a chin. You can see this is a cc of product in someone's chin. Just gives a little bit more balance to the face. This is a beautiful lip. You can see this is Restylane Kiss. This is a CC, a product in someone's lip. A really nice natural result. I would say you see all of the bad work, you don't see all of the good work. There's so many people that are getting this back, getting this done, and they look great, and you would never know. People have no idea that I have filler in my face. I'm like, of course, I have, a ton of filler in my face. I've been doing this for 20 years. But if it's done right, it can look really natural and make people actually feel more like themselves. And this is 3 syringes, so cheeks, 2 syringes of Juvederm Voluma, and then also in the fold, those smile lines that you can see Juvederm Ultra was used in this. And this is a nice jawline as well. All very nice, normal, natural results. Nobody is looking. The term that we're using now when we're trying to talk about what's happening in the space is alienization. I think we've all seen those people with the lips out of proportion, their cheekbones out of proportion. Things just don't look right. Their faces don't move correctly. And that's all things that we want to avoid. We want people to look like themselves, just refreshed. Yes, that is the jawline. Sorry. Yep. So what are some of the myths and the reality of what fillers are? The first one is that fillers are unsafe. So fillers have been studied for over 20 years with excellent safety records. We're required as practitioners when there's a complication to report it to the company and report it to the FDA. So we're supposed to do that. Now, not does everybody report every complication? I'm sure they do not. But in general, if there is a safety signal, that's going to show up over time. And there really hasn't been a lot of safety problems with fillers that are routine. The next one that's all over social media, and so many of my plastic surgery and even some of my dermatology colleagues are kind of proliferating this, is that you can't have a facelift if you had fillers previously. That's just not true. Filler can be found during facelifts. I talk to plastic surgeons all the time. Sure, we sometimes see filler. It does not mean that you can't have a facelift after having filler. It does not mean that the facelift is going to be less effective or not be as good or be harder for the surgeon. It just really is not the case. Most plastic surgeons offer injectables in their office. It's one of those things where I think that people get a lot of clicks on it, but it's just not reality. The other big one right now is fillers migrate. So fillers migrate when they're misplaced or overdone. It's not the filler that's the problem, it's the artist or the person who's doing it. They don't randomly move around your face. It's not like you put filler in your lip and all of a sudden the filler has decided it's going to make a tunnel and it's going to move up to your temple. That's not how it's going to work. What you're going to notice is the lip is the perfect place where people see a lot of migration. So when people are putting too much product in a closed space, you don't have anywhere to go but outside. And our faces move. We have ligaments, we have muscle structure, and depending on where it's placed, how it's placed, and how much it's placed, that product can move from inside the lip to outside the lip. And that's where you see most of what this migration is. And I think we see it on people all the time. They have that ski slope look above their lip. And most of the time, we want fillers to move a little bit. We want the filler to stretch so when we smile and we talk, it doesn't look like there's a big glob of filler. The other one I hear a lot is that fillers will stretch the skin. We're using tiny, tiny amounts. We're talking a syringe of filler has a blueberry-sized amount of product. It takes a lot of product to stretch the skin, and that product, it's not like it just disappears overnight. Even if we have something go wrong, somebody has a lump or a nodule, which is very rare, less than 1% of cases will result in a lump or nodule that we have to deal with. Even if I have to use the dissolver, it does not mean that somebody's skin is going to look different. It really is surprisingly does not stretch the skin. And then the other one is all filler is the same. Every product has its own personality. There are certain ones that are very stiff, and we want to use those to sculpt a jawline. And there are certain ones that are soft. We want to put those maybe in a lip. And then there's some that are a hybrid where they move a little bit and are still soft, so we might want those in a smile line. So there really are a lot of nuances to all these products. Just because they're all hyaluronic acid gels, they're all manufactured differently. They all have different qualities that make their use in certain areas better than others. So what to expect when you're coming in for filler. So it's important to be prepared. One of the things about these procedures is we all have med spas. And when we think of spas, we think, oh, we're having a massage or a facial. And these really are still medical procedures that you have to prepare for. So I usually tell people the number one thing is that I'm going to be sticking a needle in your face, and there's a chance that I could give you a bruise. So if you have any sort of major events, I say a week, but if really like if somebody was getting married or was taking family pictures, I'd really want a couple weeks just in case. That way we don't have to worry about the stress of having any downtime with the procedure, even though usually it's very, very minimal. We always have to prepare for the worst case scenario. We're going to take photos before and after. Nobody likes to get their picture taken, but it's really important. You'll leave here and you'll forget what you looked like before we had that done. And so what we have to do is take photos so that we can remember, hey, did you have that mole before because now you've noticed the mole, or did you have that line because you didn't notice the line? So it's really important that we have those before and after photos. Avoiding blood thinners, aspirin, NSAIDs, vitamin E, fish oil, ginkgo, ginger, garlic, any of the G's. If you can stop those 14 days before, that can help with reducing bruising. And then very importantly, if you've ever had a history of cold sores, letting anyone know that you have that, because we will frequently like to treat with Valtrex prior to injecting, especially if we're doing lip augmentation. There are also supplements you can take. Arnica, eating pineapple, the bromelain in pineapple can reduce bruising. And there are some products that we use in the office to help reduce bruising as well. And then stay well hydrated and eat before your appointment just to prevent lightheadedness. A lot of people come in, they haven't eaten, they're nervous, and it can make you want to pass out sometimes. Now, what's going on when we have the treatment? So you've prepared for your treatment, you're coming in. The treatment, you come in the day of the treatment, we have you wash your makeup off. It's actually really helpful if you come without makeup. Remember, these are implants, so I have to inject them on a clean face. I can't inject through an entire face of makeup, so it's really important to come with a clean face. And if you can't, we're going to make you clean it before we take photos and before we're going to do injections. I always will clean, kind of double clean before we do as well. I also extra make people use a mouthwash to make sure their mouth is clean from bacteria, as well as putting on a little surgical cap, just because I'm moving around and touching things and I really want this to be as clean of a procedure as possible. And then we're going to use a tiny needle or the cannula. You feel a little bit of pressure. Honestly, it's not very bad. People tolerate it very well, especially with we use a good numbing cream beforehand. And then I'm going to feel my work. I like to do a gentle massage. We'll give you some ice. And then you see a correction immediately, but it does take a couple weeks for the product to integrate into tissue and get the full results. And you're going to have some swelling. And I'm very conservative. I tell people all the time, you didn't get these wrinkles overnight. I usually can't correct everything in one treatment. It's really important to kind of come into it knowing that it's not just a I get fixed and then I don't have to come back until next year. We're really on this journey together to give each other the best results. And post-treatment, I want you to avoid touching the area. I don't want makeup on for a few hours. Again, I've just kind of poked you with some needles. I don't want anything that could get in there that could cause a problem. Trying to avoid strenuous exercise, heat, saunas, alcohol for 24 to 48 hours just to help reduce bruising. You can do ice cold compresses. Sleeping a little elevated sometimes can help. I can't do it. I can't sleep elevated. I always end up on my face. So you're not going to move anything around or hurt anything. And it's normal to feel the product at first. Some people, especially the first time, get a little bit nervous, but you can feel it and it will eventually integrate into the tissue. That's usually just the first couple days that you might be able to feel the product.
I'm here with my lovely patient.
So this is a quick demo. I believe it's about 4 minutes. You can just get an idea what it's like.
My lovely patient, and one of the things that's been bothering her lately is noticing that you're getting some volume loss in these folds. And this is actually one of the easiest places to do filler. We can do filler a lot of different places: temple area, cheek area, jawline, chin, lips. But what's bothering this patient is this part here. And we're starting very slow. We do not need to use a lot of product. I tell people all the time, this is a marathon, not a sprint. We can always add more in. Yes, you can reverse fillers, but it's nice to just do this slowly, make sure people look like their authentic selves. So what she's had done now, we've gotten her prepped. We're trying to keep the area as clean as possible because this is still a medical procedure. We are still putting an implant in somebody, so you're gonna see I'm gonna clean her skin a couple times. I wanna make sure that it's nice and clean before I'm putting anything underneath her skin. And then we're gonna do this, it takes a good 5 minutes. She also has had some numbing cream on, so she has a little bit of numbing cream there. That just makes it a little bit more comfortable. There are 2 different ways to inject. We can inject with a needle or a cannula. Cannulas are actually a little bit safer. One of the worst things that can happen when you're injecting filler is it can inadvertently get injected into a blood vessel. And that can cause an occlusion, which could cause some skin breakdown, even blindness in some cases. That's really in a lot of places that are, I know everybody always hears that. That's most of the time when people are treating the noses or glabella lines, but it can happen, and that's why people have to know what they're doing. Again, like I said, this is a medical procedure. We make sure everybody's safe. So we've had the numbing cream on. I'm gonna go ahead and clean that off now. I also like using a cannula because it's a little less tissue trauma, so people get a little bit less swelling and bruising that way. Another little swipe of cleaning. Make sure you're nice and clean. You still had a little bit of sunscreen on. And one more clean with alcohol. And you're a little nervous because this is your first time. We've been talking about it for a while.
Instead of the facelift.
Yeah, I tell people all the time, fillers they fill, they don't lift. So you can't really get facelift results with filler. But we can age successfully by introducing fillers as part of a really good comprehensive plan. We want your skin to look good. We want to restore lost volume. We want to stop movement. You're a big fan of Dysport, I know. All right, little stick here. 1, 2, 3. Terrible? Okay.
No, good.
Some real pressure here. I'm gonna have you turn your head just a little bit. And so I'm just gonna add just a tiny little bit here. Feels a little weird. You're doing great. Already looks a lot better. Hardest part sometimes is getting my little cannula. And that looks great.
Not bad.
Not bad at all.
Oh.
Yeah. And you can still smile, so you can see it's normal, relax. Good. And that just softened it. That is Filler 101.
Okay, so key takeaways from this is Experience matters. Fillers are not bad. They're actually really great products that have been studied very extensively and can add a lot of value to your anti-aging routine. These are not neuromodulators and we're completely different from things like Botox. Not all fillers are the same. So you have some of these that are the dermal fillers that are hyaluronic acid, and then you have those biostimulatory ones, things like Sculpture and Radius. Small amounts over time can help maintain a youthful face, and fillers really are safe and effective when used properly. One of my biggest takeaways when people are doing this is that combination treatments yield the best results. Not one thing is going to fix anything. Even when my patients go and have a facelift, they still need to have their neuromodulator treatments with Botox. They still need to have a smidge of filler because they were still going to continue to age. It's still really great to have some sort of laser resurfacing, doing all these things for skin quality. So it's not like you just get to do one thing and then for the rest of your life, you're not going to age and your skin's going to be perfect. And it's really a combination of these things that make such a big difference and help us age successfully. I over here also have a typical treatment timeline, and this is just it's not everybody is the same, but it's just a good guideline. So when you're thinking about what we need to do, what do I have to prep for the year? So this is pretty much my personal routine. I'm going to get something like Botox or Dysport probably 3 to 4 times a year. I'm about every 4 months, so mine's quarterly, so 3 times a year. Filler really is needed. So I used to have filler more often. Honestly, I haven't had to have filler for probably a couple years. I'm due for a skin booster treatment, and I'm noticing I'm losing a little bit in my chin area, so I'm going to get that redone as well. Lasers, so lasers for pigment, for fine lines. I think if anybody who follows us on Instagram saw that I had a major laser resurfacing done a few weeks ago. Really scared my husband and the people in the office. But at now, 3 weeks out, everybody's like, oh my gosh, your skin is amazing. Year-round doing medical grade skincare. I will be honest, I used to be the person that was washing with Dove soap and not putting anything on except some sunscreen. And as I'm reaching closer to 40 in the last 5 years, I have been really more. Oh, 50. Sorry. I was just reminded I'm not 40, I'm 50. See, this is what filler does for you. It makes you 10 years younger. Um, as I'm getting closer to 50, I've had to be more consistent, making sure I'm using a retinoid, a vitamin C. I still am in love with PTOX, makes my skin look really pretty, and using moisturizers and cleansers that are not just Dove soap. Energy-based treatments are still great. Radio frequency microneedling. Actually, the FDA did just put a warning out on radio frequency microneedling, and it's not on the radio frequency microneedling is the problem. Again, it's the people using it and not knowing what they're doing. And you really can do a lot of damage when you don't know what your endpoint is and what you're trying to target, and you're just following manufacturer settings. Love some energy-based tightening devices. Everest is one of my new favorites. It doesn't have any pain, and the results are actually pretty good for a non-invasive tightening device. Not a facelift, but does a really great job. And of course, we always are happy to consult with anybody, and we like to adjust the plan. It's always fluid. New things happen. People change, and their faces change, and that's why it's important that we're on this journey together. And now let me just hand it over to Sam. Oh, we're going to do the questions. Okay, I'm going to go back. So we're going to talk questions. Okay, so a couple of questions that came in. One is about platelet-derived growth factor. So this new area of regenerative medicine. So these are things like PRP, that's platelet-rich plasma. That's where you draw your blood, you spin it down, and the platelets have growth factors on them. Platelet-derived growth factor are growth factors that are made in a lab. The FDA approved that for use in orthopedics as well as in dentistry, but it's not approved in the skin. So there was a period of time where we thought this is going to be amazing. We're going to be able to inject this. We're going to be able to use it and kind of use it in this new regenerative realm. But the FDA has said, you know what, we don't have enough data on us using it in the injection realm. So we're kind of put a pause on doing that. So we're using those growth factors really mostly for after laser procedures, microneedling to enhance results, because the growth factors basically wherever you put them, whether you're putting it in a scalp or you're putting it on the skin, that triggers your normal natural process, whether it's to produce collagen or just to, help your hair grow. So that's where we are with PDGF. when we were using it. I do think that down the pike, those treatments are going to be game changers, but we just don't have the science and data behind it to use it on a wide scale right now. And then we have, oh, this is a good one because this is kind of I should have put this in the myths. Are supportive structures of the skin damaged as filler is injected? No, we're not able to really destroy anything with filler. So there are ligaments under the skin, there's muscle, there's fat, you have the dermis. We're using tiny, tiny needles to inject tiny amounts of this product. We're not able to do anything where we're able to actually cut anything underneath the skin, damage anything under the skin. Now, there are serious complications that can happen. It's important when you're getting injections that you make sure that they have an emergency protocol in place. I think you heard me talking about vascular occlusion is the one that, that's where, as I'm a consultant, people will call and say, what do I do? Do you think this is an occlusion? And luckily, we have treatments in place for those things. But in general, that we're not damaging anything just by the injections of dermal fillers alone. How long after a facelift should you wait to do fillers, for example, under eyes or lips? I won't really touch anybody for several months after a facelift. It takes 4 to 6 months for everything to kind of swelling to calm down, you to kind of feel like yourself again. So lips, they're not touching during a facelift unless somebody has a lip lift with their facelift. So that can be on a case by case basis. But usually I like to wait about 4 to 6 months before I'm doing any dermal fillers. That's not necessarily the case with neuromodulators. Those we really can do, I would say, 4 to 6 weeks after the treatment. Let's see. Somebody asked what the name of the tightening device was. We have several in the office. Ulthera, which we've had for a long time, still a very great device. Again, you have to know what you're doing with it. And then the newest one we offer is one called Everest, which honestly is great. It doesn't hurt. It works really well. And patients are seeing very good results with it. But again, not replacing a facelift. So it's really important to know what your expectations are when we're doing some of these non-invasive treatments. Are there lasers that are safe for around the eyes? Yes. Typically lasers, if we're treating around the eyes, we are going to protect with goggles. I do not have eye shields, meaning that if somebody is going to have their upper eyelid treated, I would not be able to do that in this office because that actually is a very, technically you have to put something inside the eye to protect the eye from the laser. Oh, does RF microneedling help create impact on hollowing for under eyes? No, I would not recommend if you are hollow under the eyes, I would not recommend having any sort of microneedling with energy or because you have such thin skin there, even if the very superficial level of that microneedling could get down too deep. So you would want to be very, very superficial. Probably for me, I would lean towards either the radio frequency device that's not microneedling, or I would lean towards doing something like a CO2 resurfacing under the eyes. Can laser be used on neck and chest? Yes. So we have lasers for everything. Sometimes we have to combine them to get the best results, but that's certainly something we could talk about in the office. And somebody asked about care. We don't do care credit. I will tell you one of the companies offers kind of a financing plan called Cherry. And then we also have an in-house financing plan that we offer as well. And we're very budget conscious. We know that these things are expensive. And we try to do our best to make it fit your budget. And I'll be very honest with you if I think that's not, fillers might not be what is in your budget. And I'm not going to say, hey, you should do a syringe and not get a result. I pride myself on being very, very honest about what to expect with my treatments.